Hello students, this is Dr. Anwar. Hope you guys are fine. Today we are going to discuss about the adrenal medulla. We have already discussed about the adrenal cortex, and the inner part of the adrenal gland is known as the adrenal medulla, and it is 20% of the whole gland. It has number of secretions, that is norepinephrine, epinephrine, dopamine, opioid peptides, and adrenomedullin. You can see the synthesis of the epinephrine, norepinephrine, and dopamine. It starts from the tyrosine, and due to the effect of tyrosine hydroxylase enzyme, it is converted into the DOPA, which is converted into the dopamine. Sorry for that. And then through the effect of enzyme dopamine beta hydroxylase, it is converted into the norepinephrine. To convert it into the epinephrine, it requires an enzyme phenylethanolamine N-methyltransferase. It is only present in the adrenal medulla. So only adrenal medulla can convert the norepinephrine into the epinephrine. It is all the secretions of both epinephrine and norepinephrine. 80% is the epinephrine and 20% is the norepinephrine. Half-life is 2 to 4 minutes, and epinephrine has 5 to 10 times as great metabolic effect as norepinephrine. Though it can be destroyed with the presence of monoamine oxidase to a compound known as 3-methoxy-4-hydroxymandelic acid. This is also used for a condition in which there is abnormal or abundant production of epinephrine or norepinephrine. Here you can see the levels of methylmandelic acid. It has different functions. For example, all functions which are related to the sympathetic nervous system, that is increased heart rate, contractility, inotropism, comotropism, tomotropism. It dilates the vessels in the skeletal muscles during exercise, and it constricts the vessels in the skin and the GIT. Though it increases the gluconeogenesis and glycogenolysis, and it also stimulates the sweating, and it dilates the pupil as in fight and flight response, and it inhibits secretions and the activity of GIT. You can see the effects of epinephrine and norepinephrine through different receptors. As you know, there are different adrenergic receptors: alpha 1, alpha 2, beta 1, beta 2, beta 3. So here I have mentioned, for example, in heart, they increases the heart rate, contractility, AV nodal conduction with the effect of beta 1 receptor. In vascular smooth muscle, it constricts the vessel with the help of alpha 1, and it dilates the vessel through the beta 2 receptors in the skeletal muscles. In GIT, it decreases the motility through alpha 2 and beta 2, and constricts the sphincters through alpha 1. Bronchioles, it causes the dilation of the bronchioles through the beta 2 receptors, and it causes the ejaculation and relaxation of the bladder wall through alpha, beta 2 and beta 1 receptors, and it increases sweating through the sympathetic cholinergic. Here it is the cholinergic, nor the epinephrine or norepinephrine. And in kidney, you can see it increases the renin secretion through beta 1, and in fat cell, it increases the lipolysis through the beta 1. There are some non-hemodynamic effects of the catecholamine. For example, it causes the monocyte activation and modulation of inflammation. Though it also causes the containment of inflammatory response, so that the response is not spread to the each and every organ of the body. So because if it is spread to the all organs of the body, or it is a systemic inflammation, it can be harmful to the body. Again, as I've already mentioned, it has effect on different energy metabolic processes. For example, it activates the Cori cycle, it increases glycogenolysis, gluconeogenesis, it increases glycolysis, ketogenesis, lipolysis, proteolysis, and in mitochondria enhances oxygen and metabolic substrate availability. So there are different functions, or basically these are sympathetic nervous system function which occur through the epinephrine and norepinephrine. Now the receptors. Alpha 1 receptor, it has effect through both epinephrine and norepinephrine. It is sensitive to both of them equally. It works through the inositol triphosphate mechanism through the GQ receptors. Then alpha 2 receptor, it also responds epinephrine to norepinephrine equally, and it works through the GI proteins and it decreases the cyclic AMP. So it is basically inhibitory. Beta 1 also responds to epinephrine and norepinephrine equally, but its response, beta 1 receptors are more sensitive to epinephrine and norepinephrine than alpha 1 receptors, and it works through the GS proteins and it increases the cyclic AMP. Beta 2 receptors, yes, it responds to both epinephrine and norepinephrine, but its effect is mainly due to the epinephrine, not through the norepinephrine. Its mechanism of action is same, it is through the GS proteins and it increases the cyclic AMP. Now about the dopamine, again it also has functions which are similar to those of the epinephrine and norepinephrine, but here I've just mentioned some of them, which are renal vasodilation, vasodilation in mesentery, increased heart rate, increased systolic pressure. As it is involved in the heart rate and systolic pressure, it is a part of the life-saving drug. So it is very useful in the shock, cardiogenic shock, and also circulatory shock and all the traumatic condition where there is low blood volume and low blood pressure. So this drug is life-saving drug. The Pheochromocytoma. Pheochromocytoma is basically abnormality. It is a tumor that arises from the chromaffin cells. Chromaffin cells, they are present in the adrenal medulla. These are the cell which causes the release of epinephrine and norepinephrine. So whenever there is a tumor, there will be more release of epinephrine and more norepinephrine, and the effects of all the sympathetic effect will increase. For example, patient will be having high blood pressure, increased sweating, tachycardia, palpitation and headache. The only treatment available for that is the surgical removal of the tumor. Hope you guys understand this lecture. See you next time, inshallah.